New reports out tonight that Pfizer will ask the FDA for emergency use for its COVID vaccine for children as young as 6 months old. And that prospect has some parents pausing.
Yeah, this one might be tricky. Children 6 months to 5 years old. NBC Bay Area's Cull explains the challenges, the possible timeline, and when shots could go into arms.
Tomorrow, Pfizer is expected to request emergency use authorization for its vaccine for kids 6 months to 4 years old. They'll ask for a 2-dose regimen while they continue to research how well 3 doses work, according to the Washington Post. Recently, we spoke with Dr. Yvonne Maldonado about why 3 doses may be needed. She's the principal investigator in the Pfizer vaccine clinical trial at Stanford for young kids.
The vaccine trials that have been done so far in the under 5-year-old children have demonstrated strong safety, but just not the degree of antibody responses, especially in 2 to 4-year-olds. So it is hoped that a 3rd dose in the under 5-year-olds will provide a strong antibody response.
If approved, kids will get 1/10 the dose adults receive.
I think we have to be a little careful here. I'm sure FDA and CDC will weigh all the evidence very, very carefully, but I don't think this is necessarily a slam dunk.
UCSF's Dr. George Rutherford says it may be trickier because data on that 3rd dose still needs to come in.
For these mRNA vaccines, we really need to think in terms of a 3-dose series rather than 2 doses and some mythic booster down the line. Let's have a real close look at the data and make the most prudent decision. I mean, we have to be extra, the layers of safety for vaccines for younger children are even higher.
The New York Times reports if Pfizer waited for data on a 3-dose regimen, the data would not be submitted until late March, and the vaccine might not be authorized for that age group until weeks later. But if the 2-dose series is approved, the vaccine could be ready by the end of February. In the South Bay, Cull, NBC Bay Area News.